What are the breakthrough non-invasive tests for liver fibrosis? Imagine being able to check the health of your liver without needing a biopsy. That's exactly what modern science is making possible with new non-invasive tests for liver fibrosis. These tests are game changers because they offer safer, easier, and repeatable ways to assess how much scarring has occurred in the liver. This is especially important because liver fibrosis can progress to cirrhosis or liver cancer if left unchecked. There are two main types of these innovative tests. The first type uses blood samples to look for specific markers that indicate fibrosis. The second type uses imaging techniques to measure how stiff the liver tissue is, which correlates with the amount of scarring. Blood-based tests include the FIB-4 Index, which is simple and affordable. It combines liver enzymes like AST and ALT and platelet count. This test is especially good at ruling out advanced fibrosis because of its high negative predictive value. Then there is the enhanced liver fibrosis test, which measures direct markers like hyaluronic acid and procollagen. It provides a numerical score that helps doctors understand the stage of fibrosis. The Fibro test or FibroScan combines several blood markers into an algorithm to estimate fibrosis levels. These tests have been validated in different liver diseases like hepatitis C and fatty liver disease. More recently, new scores like AGILE-3+ and AGILE-4 have been developed. They incorporate clinical and lab data to better detect advanced fibrosis and cirrhosis, especially in conditions linked to metabolic health issues. On the imaging side, transient elastography, often called FibroScan, is widely used. It uses ultrasound waves to measure how stiff the liver is, which directly relates to fibrosis. It's quick, painless, and can be done in a doctor's office. Magnetic resonance elastography, or MRE, is another powerful tool. It uses MRI technology to give very precise measurements of liver stiffness. While it is more sensitive and specific, it is also more expensive and less available. There's also acoustic radiation for impulse imaging, which is another ultrasound-based method, offering an alternative to FibroScan. Some clinics use multiparametric MRI, which combines elastography with other MRI techniques to give a comprehensive picture of liver health. These non-invasive tests are supported by major liver health guidelines and are increasingly used to identify patients at risk of advanced fibrosis or cirrhosis without the risks associated with biopsy. They are especially helpful in managing chronic liver conditions like fatty liver disease, hepatitis B and C, and other causes of liver scarring. While a liver biopsy remains the most detailed method, these newer tests allow for safer, repeated assessments and earlier detection. This means doctors can intervene sooner to prevent the progression to more serious liver problems, including liver cancer. In practice, doctors often start with simple tests like the FIB-4 Index because they are easy to do and inexpensive. If results suggest possible fibrosis or are unclear, they may then proceed to more specific tests like elastography or advanced biomarker panels. This step-by-step approach helps balance cost, accessibility, and accuracy. It's important to remember that no test is perfect. Factors like patient age, obesity, or other health conditions can affect the results. That's why healthcare professionals interpret these tests within the full clinical picture. If you're concerned about liver health, always consult a healthcare provider who can recommend the most appropriate tests and follow-up. These advancements in non-invasive testing are helping millions better understand their liver health safely and effectively, paving the way for earlier treatment and better outcomes.